Welcome to Sunbeam Healthcare and Rehab Center. Frequently asked questions on echolalia. Why does my child repeat everything I say? Repeating words or sentences, called echolalia, is often how children process and practice language. It helps them learn sounds, words, and sentence patterns. Some children also repeat speech to show they've listened or understood. What is echolalia? Echolalia means repeating words, phrases, or sentences heard from others or from media like TV. It can be immediate, repeated right away; delayed, repeated after minutes, hours, or even days. Children may echo for many reasons: requesting, confirming, self-soothing, or rehearsing. Is echolalia only seen in autism? No. While it's common in children with autism spectrum disorder (ASD), echolalia also appears in typical development 18 months to 3 years. Children with language delay or intellectual disabilities. Neurological conditions like aphasia or Tourette's syndrome. Why does echolalia happen? Echolalia helps children process and learn language. For some neurodivergent children, it also supports emotional regulation, memory, and comprehension when spontaneous language is difficult. Is echolalia normal at certain ages? Yes. For toddlers, repeating words and phrases is a normal stage of language development. It usually reduces as expressive language improves around age 3. When does echolalia stop? It typically fades as children gain expressive skills. In autism or language delay, it may last longer but often becomes more purposeful and meaningful with support. Does echolalia lead to speech? Yes. Research shows echolalia can be a bridge to functional, spontaneous speech. With adult guidance, children often modify echoed phrases into meaningful language. Should I stop my child from echoing? No. Avoid stopping or correcting them; it may discourage communication. Instead, model short, useful phrases and expand what they say. Example: child, want juice. Parent: yes, you want juice. Let's get some juice. How can I help my child with echolalia? Model simple, functional language. Use visual supports: pictures, symbols, routines. Give your child time to respond. Interpret their echoed words to understand intent. Will my child outgrow echolalia? Many children do as their communication improves. For children with autism, echolalia may evolve into useful self-talk or scripts for thinking and coping. What type of therapy helps echolalia? Evidence-based therapies include speech and language therapy (SLT), naturalistic, play-based, functional communication. ABA-based language programs, when applied collaboratively with speech and language therapies. How can I tell if it's a communication issue? Echolalia shows repetition with possible purpose. A communication disorder involves difficulty understanding or producing language. A speech and language therapist can assess whether the repetition is part of typical development or an underlying need. Does echolalia mean my child understands what I say? Sometimes. Repetition may show partial understanding or recall of familiar routines. Speech-language therapists assess whether the child's echolalia is functional communicative or non-functional rote. What is the difference between immediate versus delayed echolalia? Immediate, repeats right after hearing it. Example: want water. Delayed, repeats later. Example: quoting a cartoon hours later. Both can have meaning and purpose. Can echolalia be meaningful? Yes. Many children use it to request, protest, regulate emotions, or connect socially. It's often a step toward independent language use when adults respond meaningfully. Can echolalia occur in bilingual children? Yes. Repetition across languages is a normal part of dual language learning and not necessarily a concern. What should I avoid when my child echoes me? Avoid forcing them to say it differently. Overcorrecting. Asking rapid or repetitive questions. Instead, use calm, encouraging responses. How can I help my child move from repetition to conversation? Offer choices instead of yes/no questions. Use scripts for routines, then vary them gradually. Encourage turn-taking and play-based talk. Praise attempts at original speech. Does echolalia affect reading or learning? Not directly, but limited comprehension can affect learning. Speech and language therapy support strengthens both understanding and communication, building school readiness. How do therapists assess echolalia? Speech and language therapists observe and analyze when and why echolalia occurs, how it supports or limits communication. They use structured tools and parent input to design individualized strategies. Key takeaway: echolalia isn't just copying, it's communication in progress. With patient guidance, responsive interaction, and evidence-based therapy, children can grow from repetition to meaningful, independent speech.